Right. Anyone want to do a demo? Has anyone got a physical complaint that's bothering them at the moment?
Yeah, I've got knee pain.
Knee pain. Cool. So how long have you had that?
It would definitely be chronic, so more than 33 years.
33 years, wow. Do you know what caused it?
Yes, I think it came from, originally from ruptured intervertebral end plates in lumbar 4-5. And that had the effect of weakening the support of the nerves on the vastus medialis. And so the patella doesn't track properly in the trochlea, and it's caused differential erosion in the cartilage. I've had that repaired, had the cartilage cloned and repaired, regrown in situ. And that was 11 years ago. And it's been very successful, but it's now coming back.
Okay.
So the underlying problem to me was never really dealt with.
So the pain is on the earth, spleen, stomach, or between?
More spleen and between spleen and stomach. Yeah.
Yeah. Okay. And how does it affect your life?
Physically and demonstrably, I can't easily squat, and that means then that I have to bend at the back through the hips more than I do. You know, I should just squat down more easily. That in turn means that the legs don't get the proper stretching and contraction of the thigh muscles that they should.
Yeah.
So it has a, you have to be someone who understands how these things work to actually understand what all the implications are, because it doesn't seem obvious, if you see what I mean. It's only when you understand more how you've inhibited what you do as a consequence of avoiding pain and inhibition that you begin to see how that has a knock-on effect in other locations. That make sense?
Yeah, sure. And what's the feeling like if you were to bring a feeling into that part of the body as well, and or into your life and how it affects you? What would the feeling be?
My emotional response to it is frustration.
Frustration. Okay.
Because I can't do something simple. I can't do something that I think I should just be able to do.
Yeah. And would you say this is the first time in your life that you've been in a situation where you felt frustrated because you couldn't do simple things?
No, I would say it's a repeated experience in my life.
So how far does it go back?
I've never done that analysis, Paul, but
that's okay.
When doing something is kind of obvious as a pragmatic solution to something that will benefit all and will hurt no one, then I get very frustrated when a local or societal paradigm blocks it. Does that make sense?
Yeah.
So in other words, on a global scale at the moment, we all need to be doing stuff to change the climate and to save the climate and to save the earth. And I'm getting incredibly frustrated. There's no leadership from our leaders to actually resolve this problem.
So you
get that?
You feel a bit powerless then?
Yes.
So again, I'll just ask the question, is this the first time in your life then that you've felt frustrated that you couldn't do simple things and you felt powerless?
No. This has gone on for decades, probably even as much as my childhood. But I can't think of a specific event. But it's something I've always thought. I've always had this notion, and people would say, "Are you just being naive?" But when something is a pragmatic solution for the benefit of everyone, and we're not doing it, am I just being naive, or am I a frustrated pragmatist?
Well, that's a long debate, that one.
Well, it's always because the information for all of us as individuals, as practitioners, as patients, we have the view from here, don't we?
Well, I've got a different. I'll share that with you in a moment. So can you make a connection then from what you're experiencing from your knee pain all the way back to even things that occurred when you were a child?
In the sense of make a connection, how do you mean make a connection?
Well, let's just say you're a small child and you're in a situation and you can't do something simple. And you've already developed a need to be able to do that. Already the actual realization that learning is through stages of growth. There's somehow developed in you a frustration that you can't do things good enough or quick enough. And quite likely also a situation where you're not in a position of power. And if you go back to when you were being taught at school, and the way you speak, you're very educated, you can tell your mind's very strong. And we know through Chinese medicine that the early life development, especially 4 through 7, is the stage of the hun. So that's when the child is creative and dreams. So consequently, the education through those years should be encouraging that aspect of learning. And what was your learning like at school?
Horrible. Absolutely horrible.
Yeah.
I suffered. School was a horrible experience from the age of 11 onwards because I suffered terribly with bullying.
Yeah.
I neither want to fight, know how to fight, nor am I interested in anything of that nature. Why would I want to hurt anyone else?
Yeah.
I just don't get that. And so I ran away, and it was 6 weeks before school came and knocked on my parents' door saying, "Your son doesn't appear to be attending school."
How come it took 6 weeks for your parents to recognise that?
Oh, I was clever. I was very, very clever. I would go to registration.
So you didn't tell
which meant
you didn't tell your parents?
Didn't tell, absolutely not.
How come?
No. Because they would just make me go back to the place I didn't want to be because of the relationship that I was having with my contemporaries.
Do you have children?
Yeah.
And how old were you when that was occurring, that bullying?
11 and 12.
So have you got a son and a daughter? Or do you have a son?
No.
No.
No, I have 2 daughters.
So if your 11-year-old daughter was being bullied at school, who would you like her to talk to?
Me.
So,
because I can relate the experiences that I had, and perhaps now I know better how to deal with them.
Yeah. And so with that reasoning then, what do you think she might have felt if she was unable to come and talk to you? What do you think must have been going on?
Hang on, in what situation in this hypothetical situation of my daughter?
She's being bullied and there's no way that she's going to talk to you about it. What do you think is going on for
her? Isolation, loneliness, powerlessness, frustration, a whole range of
Yeah.
feelings and emotions.
Yeah. And also the idea that she couldn't trust her parent.
Yeah, absolutely.
Mm.
Absolutely. Well, that because your parents, let's see, my age tells me that my parents were just part of the system. You know, there was an unswerving conformity generally from parents to the paradigms of society.
Yeah. So just as a demonstration, so if you was in my clinic, so what I basically just done then, so from the feeling that you're getting from your knee pain, there's a direct connection all the way back to early experiences in your life and the way that you approach them. So it's a pattern, and the pattern's eventuated into the state where you can't run away anymore. And that's what I mean by
That's true. Literally.
Yeah. So the roughness is increasing. So with in treatment, then what I would do is, while I was doing the needles, I basically just get you to focus your attention on your knee. And then we get a conscious connection to the somatic experience that's occurring in the body, because that's where the intrinsic memory of very early life conditioning that put you through into those circumstances, that's where it sits in the body. It's undischarged stress. And animals, they naturally, in a stressful situation, they might freeze when there's a possibility of danger. As soon as the danger's gone, they shake it off, they discharge the emotion, and then they get on with their life. Children don't do that. Yeah? So when we do imbalanced method acupuncture, and we can actually track the feeling as well in the body. Once you've done the needles, you can track where that feeling goes to, and you can follow it like pain. But just a simple connection of the mind to the feeling, and then to the area where there's discomfort, starts to discharge those patterns. That makes sense?
Interesting.
Yeah. Any questions or comments on that?
From everyone.
Anybody? Yeah.
Interesting to hear what everyone else thinks.
So Paul, you're saying that when you're doing the needling, you're asking the patient to focus on the place where they have the pain, or they have to focus on all this childhood memories, like what exactly they have to focus on? Yeah,
really the focus is on the body. It depends how much time you've got and what ways that you practice and what your intention is. It's simple enough. If you can make a connection to a current event and you can show them the pattern is not the current event, it actually goes way before, people get that straight away. They get that connection, and then they start to think about it differently, because that's the genetic shadow in the traumatic memory. Is anything that we defend against in our present circumstance is not the present circumstance at all. It's a memory, and it's a memory of a time when we were powerless. So you can just ask them to tune into their knee or their shoulder or wherever it is. Not with an intention to change it or make it be anything different, but just to give it some attention. And then that starts to refire the nerves. So that's where we get neuroplasticity, epigenetics, neural pathways, creation of new neural pathways. That's the somatic healing that occurs through attaching mind to body.
Okay, thank you.
And a good place to start, Malagarani, is with your own sensations and feelings.
Yeah, it was an interesting little voyage you took me on in that few minutes.
And
thank you for sharing.
Yeah, thank you. And just to share another thing about
no problem.
About climate, about the climate, is that when we come from competition and creativity, or if we come from competition, the power is outside of us. So the frustration is nothing to do with climate change. It's actually to do with the internal power. And the way to generate that core understanding, which is your essence, basically, which is no harm to others, is to have that in your thinking. And that thinking is that the world is an incredibly resilient and way more powerful than the individual mind. And if we see it in that point of view, then we generate abundance and prosperity rather than destruction. So if you've got millions and millions of people focused on disaster with climate change, you know, it's pretty sure that we're going to create that.
But how does that stop we need to change their action so that they do take the action to redress the way they operate?
Well, if you're in that arena and that's your work and you're dedicated to climate change, then that's what you do. But if you're kind of like sitting at home frustrated, just doing acupuncture and your normal stuff, then that energy is wasted. It's putting frustration into the universal energetic field. So the aim there is to live harmoniously within your own life and see prosperity and abundance in all ways. And that's the creative mind. And then that will unleash the stored energy in the base of the body, and that will put you more in tune with your path. And I'm not sure, Malagarani, if you know much about the Krishna consciousness, but do you know what the energy of the knees is in Krishna consciousness?
Sorry, what is it? Energy?
You know the energy of the knees in Krishna consciousness?
No, I have no idea.
So it's the energy of devotion, and it's about bringing a person to their knees.
Oh, the knees.
Yeah.
All right.
So in that aspect, it's about where you place. Where is your thinking placing your devotion? So if you're devoted to disaster, that's where your thinking's creating. So every thought basically creates an entity. Okay, so we're about. Thanks for that, holistic Sifa.
I didn't know whether to change it when I saw the identity that the computer was going to use. But I'm Anthony, and I prefer to be Anthony.
Yeah, I like Anthony. Yeah, and I'm really glad you came.